Hi, I'm Michael Reeder. I'm a psychotherapist in Baltimore City, Maryland, and I want to talk a little bit about using insurance benefits. It's an area that's very confusing to both providers and to clients both. So I'm going to play talking head here for a moment while I try and go over some notes and see if I can explain the situation a little bit better. Uh, for those who don't make it all the way through this short video, I want to mention my contact information. You can get more on my practice and what I do at www.hygeia counseling.com, and one of my phone numbers is 877-823-3439. And let's talk a little about insurance. These days I am taking APS Healthcare. I'm taking Care First, Blue Cross Blue Shield, Magellan, Maryland Medicaid, and PAC, Primary Adult Care. Also on Hopkins EHP and the US FHP, that's one of the TRICARE Prime plans. And I'm working on some others as well. I'm also on Aetna, which a lot of the student health centers in the Baltimore area take. So one of the things that my office tries to do is verify and explain your benefits to you. That's always a little difficult in that the final determination is made by the insurance company. So we take our best guess, not guess, but we call them, we verify benefits, we find out what they say, and we report it back to you. And 95% of the time that is correct. So I want to explain some of the terms that are involved and what you might expect using insurance. One topic that comes up is the topic of a copay or coinsurance. So you want to see a therapist, myself or someone else. You want to use your insurance, and you want to know what's covered. A copay is something that you need to pay at each session. Same with coinsurance. Varies widely. Some people have none. Some people have a high one. A second thing that will come up is a deductible. A deductible is an amount of money that you need to meet, usually each year, usually on an annual basis. Usually it's at the start of the year, but it varies when it starts. So you might have, say, a $500 deductible. So somebody would come to me and their insurance might say, well, you have a $15 copay and you have a $500 deductible this year, 0 of which you've met. So the amount that the insurance is paying me minus the copay is what would go to the deductible. So, and that varies depending on the plan too. I will negotiate a rate or be told what the rate is for each insurance company, and I agree to take a lower rate than I usually charge in return for the insurance company sending me hopefully a lot of clients. So let's say that the negotiated rate is $80. All right. So this person would pay a $15 copay, and then the insurance would usually pick up the rest unless that $500 deductible has not been met, in which case the person would pay $80 a session until they hit that $500, and then they'd just be paying $15. There's other factors that matter, but those are the two main ones. And I'm happy to go over this in person or in more detail on the phone, because a quick video sometimes doesn't get it. There's also the topic of whether you're in-network or out-of-network. If I'm an in-network provider, that means that I'm on the plan of the ones I mentioned before, like Hopkins EHP, Care First, Blue Cross Blue Shield, etc. And the rate is probably going to be, that I'm paid is probably going to be lower. If you're out of network, then you need to find out, and there's some questions I can give you to ask your insurance. Um, do they cover out-of-network providers? Will they give you some money back towards what you pay me for somebody out of network? Another thing that comes up sometimes is number of authorized sessions. So some insurance plans will say, well, the number of sessions are unlimited, and others will say, well, you get 20 sessions, and then we'll reassess if there will be any more. Often the plans that provide a certain number of sessions also have pre-authorization. So some plans you can just come and see me. Others I have to get pre-authorization, perhaps even submit a treatment plan, and they'll say, okay, you are now authorized, Michael, to see this person for, say, 20 sessions. So sometimes I need to set the initial intake appointment a little further out if I'm needing to get pre-authorization and go through those hoops. One of the issues with using insurance is I need to provide a medical diagnosis. If you're seeing me out of pocket, we just work on what you need to work on. And we largely do that even in insurance. But they require some sort of diagnosis. So I can't just say, well, you're angry and you want to work on anger. I have to have a medical diagnosis that goes to the insurance company, goes in your records, and there's pros and cons to that. I also have to keep records for the insurance company, which occasionally they audit, and some people, they don't care, and other people, well, they don't want an insurance company looking at records, seeing a diagnosis. Some people don't want an insurance company second guessing the treatment goals that we come up with together jointly. So, pros and cons to using insurance. But people need to find a way to pay, especially in the recession. The term private pay just means, or self-pay just means that you're paying yourself without using insurance. Most of the time, most diagnoses I would report are covered, but occasionally there'll be an insurance company that, for whatever reason, does not cover a specific condition. That occasionally comes up. So people ask me a question that I really want to be able to answer, which is, what do I owe? And that ought to be a simple thing, and usually is, but it depends on whether you're in or out of network. It depends on the rate that your insurance company is paying me. Usually I'll know what that is, but occasionally they have a couple of different rate scales. It depends on whether or not your deductible has been met, and it can take 2 weeks, even up to 8 weeks, to get an explanation of benefits back from the insurance company for the initial session. So sometimes there's a lag. So I do my very best to explain carefully what's due, but this is why myself and some other providers just sometimes have a problem figuring it out. So I hope that's not totally confusing, or at least is a starting point for discussion. So it's important to find out whether you're seeing myself or someone else, what your copay is or coinsurance for each session, what deductible, if any, you have to meet for the year. Usually it's a year. And if there's pre-authorization needed and number of sessions to keep track of, which usually the provider tracks for you. It varies widely, even within the same insurance company. So I may see one client who has no deductible and a $10 copay and unlimited sessions. And that person's going to be paying $10 a session to see me. Someone else with the same insurance company but a slightly different plan, working for a different company, may have, say, a $40 copay and a $1,500 yearly deductible. If that person's young and healthy and seeing no one but myself, all that $1,500 goes towards is our sessions, the difference between the copay and the rate that the company's paying me. So they're basically going to be paying the full rate of each session, and the only benefit of the insurance to that person is that it's not my posted rate on my website, it's the negotiated rate with the company. So I hope this has been useful, and I would love to talk more about this or the services I actually provide, which are discussed at length on my website in free 10-minute phone consultations that I'm happy to set up to discuss what's going on for you. And again, you can go to my website at www.hygeia counseling.com, or give me a call on 877-823-3439. Thank you very much.